But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood, therefore not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood, therefore no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can, and don't give up until medical help arrives or an AED is present. You can do it.
Now we're going to have a look at using a bag valve mask or BVM. With the use of a BVM and oxygen, we're going to give the patient approximately a 95% pure oxygen flush. Using the mask is important that you do it correctly. We use a technique called the anaesthetist grip. 2 fingers onto the mask itself, 1 at the top and 1 at the bottom. 1 hand onto the bag itself underneath the holding strap, and 3 fingers remain free flowing in the air. The mask is then placed onto the nose and face, covering both the airway and the nose at the same time. The 3 fingers link onto the jawbone, and then the head is rolled back, opening the airway, and the 2 top fingers press down, giving you a good seal with the mask to the face. The bag is then squeezed using a nice gentle pressure for approximately 1 second per breath. Maximum of 2 breaths, and we look for the chest rise and fall, and we feel for any strange sensations, noises, gurgling or bubbling whilst squeezing the bag. This will indicate still problems with the airway, either the tongue or fluids still in the airway, occluding the flow of oxygen. So the bag and mask also becomes your eyes and ears whilst being used. If you feel any strange sensations, bubble or gurgle, or if the bag doesn't inflate properly when we squeeze, then we start to look at the airway again because there is still an occlusion somewhere.